And good morning, I'm Dr. Deuk Magin here at the Deuk Spine Institute with a patient who's traveled 10 minutes from Merritt Island, is that correct?
I'm in Vieira.
Oh, Vieira, just down the street. Okay, local. You just had the Deuk laser disc repair on your lower back yesterday for a herniated disc at L4-5. It was a foraminal herniation, and it's one that is tough for doctors to find and discover. But we saw it at Deuk Spine, and you were having horrible back and right leg pain. That was yesterday before your surgery. Here you are less than 24 hours later. How do you feel?
Wonderful. Walking straight. I feel no leg pain, no back pain, just a little sore, but that's about it.
How long have you had the back and leg pain for?
Since 2012, 2013, since my surgeries.
You live with pain.
Right.
He had, I guess, a microdiscectomy done.
Correct.
Did that fix him?
No, a month later he was back in surgery.
What kind of surgery did you have done?
The fusion, S1, L5.
So you had an L5, S1 fusion, good. Did that fix your problem?
No, not at all.
And their suggestion was take the metal out, and that they already seen that he had a problem with the disc above that one, so let's take the metal out first, then within a year go back and do another fusion on the disc above that.
And that was the metal they put in you?
Yes, sir.
So they put metal in you for the fusion, and then they told you afterwards, well, we got to get it out because that's what's causing your pain.
Right.
Kind of silly, isn't it?
Yes, sir.
All right, glad I'm not the only one that thinks that's a bit silly, but that's right, it is silly. And it's not just the surgery, the fusion. Didn't you have pain management and stuff in between?
Yeah, so I had shots and a nerve specialist do some stretchings and hands-on stuff, but that's about it.
So you had shots, you had therapy, and then you had surgery, and you had more shots and therapy. And that's the problem is you're like I think about it as like a washing machine going around and around, and they're just washing the money out of your pockets and washing your life away because your quality of life has not been good, has it?
No, not at all.
How did you find Deuk Spine Institute?
My wife.
I couldn't believe it, amazing. Last time he had surgery, 9 days, he couldn't even hardly move. And I mean, he was up last night pacing the floors, antsy, trying to find something to do.
This must cost your family a lot of money dealing with the pain.
Oh yeah, well, and it cost him not just, with the pain, he's not able to do the stuff he likes, fishing, throwing the baseball with our son. So just just doing life things he's not able to do that because of all the pain that he goes through. So now we're just so grateful that we found you guys because, I mean, I have not seen him walk like this in 19 years.
And that's just one night.
Yeah, that's just one night.
And so, no pain meds?
No pain meds, no anything. No medicine. He had took no medication whatsoever last night.
So just to recap, your husband, like millions of people, had back pain. He went and had microdiscectomy, which is a procedure where the surgeon basically ruins the back of the spine in order to get to the disc. That caused instability, which then he needed a fusion done shortly afterwards, right?
Yes.
You said a month later?
Yes, a month later.
And then you went back again because he was still in pain and worse after the fusion.
Right.
And they told you he needed another surgery, a third one.
Correct.
To get the metal out.
Right.
And then he was going to come back for another fusion after that.
Correct.
And then there would be more fusions and more fusions, right?
That's never ending.
Never ending. And we see this all the time with people that have open back surgery, invasive back surgery is a cycle of over and over, more and more surgeries. Well, he's done now.
Yes, thank you. And we're so grateful.
We have one more muscle thing to fix and then we're done.
Yeah, you might have to do something to me so I can keep up with them.
You ended up having faith. You had the surgery done yesterday. You can see in the video, we made a tiny little cut, just 7 millimeters on your back, and we got the whole surgery done. We found the herniation, we cleaned out the tear. And while you were in there, I tested your disc at L4-5 above your fusion, the one that's bad. You had 10 out of 10 pain. And I asked you, is that your typical back pain?
I heard that.
Yeah, and you said yes. So you're going to watch your surgery today. We gave you a video. Henry did a great job recording it and broadcasting it. But you're happy today. You've had your back fixed.
So I'm walking straight.
You're walking straight.
Walking straight, not leaning.
And do we have you on pain medications at all today?
No, nothing.
You didn't take any, did you?
Nothing.
You didn't need it?
Zero, nothing.
Yeah, with the cut on your back being that big, it's a Band-Aid. There's no trauma inside your body we're doing, so there's no need for pain pills. That's one of the nice things about Deuk laser disc repair compared to open back surgery like fusion, is that we don't do trauma inside your body. There's no need for pain medicines afterwards.
The fusion caused hernias, and I had a hernia surgery.
Really?
Yeah, because of the pain pills.
So all the complications from fusion, including, I've not heard that one, having to have a hernia surgery on your groin, right?
Mm-hmm.
Wow. So there's another complication from
Yeah.
fusions. Well, you're not going to have that problem anymore, are you?
No, sir. Hope not.
Well, is there anything else you want to share with your fans out there who are listening to your story?
The best thing that's ever happened to me. I'm walking straight, no pain. I feel like I can go do what I usually do, and especially fishing.
Yeah.
I miss that.
We're going to get you there. You're
Thank you,
welcome.
Deuk. Thank
It's
you.
my pleasure. Get back to fishing.
Yeah.
I just want everyone to know, please make sure you educate yourself before you do this, because you only have one life and you want to make sure you live it to the fullest, and doing these back surgeries that these doctors recommend is not the way to do it. You need to come here and at least just give it a shot. Let them look at your MRI. I think you said you can do the reviews online if you don't, out of state, but please check here first and let Dr. Deuk, go through all of your records, because I'm telling you, this is the best thing that we've ever done.
I'm happy for you guys.
Oh, thank you so much. You just don't even know how, I couldn't believe it. My son was like, Dad, you're supposed to be laying down, and he's in there walking around, we couldn't keep him in bed last night. So it's amazing.